evening. My name is Irene Caldwell, and our group is the Convenient Care Group. There we go. And we are focused on providing convenient care, expected and unexpected, and full access for all your healthcare needs at any time. Our objectives is to recognize the need for 24-hour care and by offering 24-hour care, the decrease in the use of ERs for unnecessary visits. We'll have a multi-practice group that will have different specialties so that we can keep everything all within our practice. Lower the overhead cost by allowing patients to utilize a budget-friendly office system, one billing, registration for all physicians, and having like a community campus care atmosphere. We'll have 7 office locations. Our home office would be in Newark, and having Wilmington, Middletown, Dover, Milford, Seaford, and Dewey as different locations. Diana, let's speak about our office staff.
Good evening. Our office staff will consist of over 7 offices. Each office will have 9 internalists, 3 pediatricians, multiple radiologists, lab techs, LPNs, and 15 office managers. Our physician schedule will consist of it's a 9-hour day, but it's 8-hour work, 1-hour lunch. So from 7 to 4, 3 to 12, and 11 to 8. Each physician actually overlaps the next physician to allow that completion time of their schedule. With our office location, making it a 24 hours, we were able to have a visit capability per year to an internalist. Sick visits, which would be 429,240 people. It sounds like a lot, but if you take how many times you get sick or how many times a family member gets sick, it does equal out. We will be providing physicals 24 hours a day. If we provided physicals for 1 hour a day for 365 days, it would equal 53,655 visits. A lot of people to be able to provide, on top of keeping our schedule, sick visits, providing our routine care. If we did it for 30-minute scheduling, it would be 107,310. So whichever the physician feels that they need to do, if it's going to be an hour or 30 minutes, it can work. Our pediatricians will see, they can see approximately 143,000 visits, sick visits per day, and again, not per day, excuse me, per year, and 35,000 physicals for 1 hour or 75,000 for 30 minutes. Convenient care, we have web access which will allow patients to go on and complete an online registration. They can request schedules, billing, medical records, providing a positive atmosphere. Shuttle for 10-mile radius for elderly patients. The biggest thing is getting your elderly patients there. Providing that convenience will allow us to make sure that they get there to their appointments. Daycares in 2 offices. This is our pilot program for child and elderly care. Immunization clinic, women's health clinic, diabetes clinic. Patients will also have an option to complete a survey after all medical visits. Always nice to know what you can change after a patient comes to see you. Our medical care convenience always starts with the patient, whether a patient's sick, needs care, needs a physical. For scheduling, we start our EMR, which, starting the patient's chart, records, and registration. The appointment is set. We have our well family, and then we have our office follow-up. Patient care. When patients get sick, it's at the most inconvenient time. Or patients and people are required these days to work longer and later hours at work, so being convenient for them, we can work with them to make sure that they get their treatment, they can get their physicals done.
For our scheduling and registration, we will offer online registration and online appointment requests. It is a hassle to try and get into offices and try and get in there with doctors being busy and for the patients to get the best medical devices that they can be inquired to have. We offer 24-hour services and we offer email reminders. Sometimes it's a hassle for people to remember when they're scheduled for an appointment, especially if they're feeling very sick and it could be a serious disease or illness, and we want to get them in so they can get checked out. We offer friendly and knowledgeable, professional staff, and quarterly reminders when the patient is due for physicals, PAP exams, and immunizations. This is a diagram of our patient care flow chart. Obviously, the family physicians and the GUI and the pediatricians all work together, so they have to have a good working environment so everyone can get in and there won't be any miscommunications with the health of the patients, because that's in the end is what mostly matters. The physicians group, radiology and laboratory, again, they all work side by side, so the arrows show that with the physician groups and radiology, they all interact, so they all have to be on the same page. Again, this is health that we're talking about, so the more slip-ups that happen is worse for the hospital and things that can be done. Our EMR, like everyone else, the electronic medical records. When it comes to health, the internet and the systems being used, they help limit the times when numbers can get mishandled or there could be miscommunications within the hospital staff, and this would be the most effective way to limit less problems with dealing with so many patients and physicians. There could be miscommunications again, and dealing with the health. All we want is for our patients to have the best care. The reporting provided in the electronic recalls and the routine visit alerts, again, will help the doctors know the numbers are accurate when they put them in, and so there are less miscommunication with the numbers. Again, they're tricky when it comes to this types of things, so we just want to make sure that our patients get the most out of their visits to our hospital.
So under our well family side, we would have routine services like physicals, sick visits, well baby checkups, medical follow-up exams, and then we would be able to attend to like minor accident care such as like stitches, burns, broken bones, sprainings, to reduce patients having to use the emergency room for these services and cut that cost. Our office follow-up, each patient will be assigned an LPN who will provide their follow-up service. The LPN will, before the patient leaves, teach the patient how to use dressings, administer their medication, use any kind of equipment that they would need for their health care, so that they're aware of how they need to take care of themselves after they are discharged. And then 24 hours after the discharge, that same LPN would call them to follow up with them, see how they're doing, how they're feeling, triage, make sure the patient's starting to recuperate properly. Then the LPN, depending on the services that the patient had, would schedule like a home visit to the recently discharged patient to, just verify that the patient's taking their medications properly, confirm the patient's recovery, and then perform like any minor lab services that they could perform at home, and then follow that up with a 21-day follow-up call, just to make sure that the patient's health is back up to par. We also offer an immunization clinic, which would be a walk-in immunization clinic. It would provide immunizations for children and world travel. all immunizations that would be required for schools and colleges for your patients, vaccinations to prevent shingles for our patients 60 years old or older, and then the travel immunizations. Most of the time you leave country, you need to schedule this about 4 to 6 weeks prior to your travels to get the appropriate vaccinations before leaving.
In our radiology department, we will have mammograms, x-rays, MRIs, CAT scans, and ultrasounds. For the mammograms, for women to help detect and stop breast cancer. In our x-rays, these are usually for, more advanced broken bones. And then you get to the MRIs where it shows more ligament damage. And we offer CAT scans for the brain to help stop damage or anything that can be done there to stop that. And our ultrasounds for kidney and for a woman being pregnant. In our laboratory department, this is the department where the necessary tests that would need to be done, such as pap smears, diabetes testing, with lab panels, so many tests for cholesterol and things like that, to where it could be stopped early so it doesn't get any serious. I know cholesterol damage is something that's progressing with the people in the United States. So the sooner that we can check down on it and get that under control, the best people will be in the future.
Next, we would also have a women's health clinic that would start treating patients as early as in their their teenage years, with their first pelvic exam, the HPV vaccination to help prevent cervical cancer in young women, administering the birth control, pregnancy, and